My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk again. And action. Hey everyone, it's Dr. Rick. Gio had a question about snapping and popping joints. Snapping and popping joints. Noisy joints. Not necessarily painful, just noisy. Before we get into it though, if this is the first time you're finding me and you like what I talk about, don't forget to share this with other people that are the same as you and or interested, and hit the subscribe button down below because I do these all the time. It's mostly the question of the day as far as the Minute Clinic goes. I also hit the alert button to find out when I do new videos. So, what is this business of snapping and popping noisy joints? You know, everybody kind of knows you can have it as far as neck popping. That seems to be, or low back popping when you're young. Seems to be really popular. But a wide variety of different people make different noises. A lot of people with iliotibial band syndrome will pop their hips, especially young ladies. People who are in ballet, dance, jazz will have a lot of ankle popping. People who play instruments will have finger popping. People who have been through injuries and have arthritis at a later age will have a lot of neck popping. Or shoulder snapping. I have done a video on shoulder or scapular dyskinesis, which essentially is what happens, or the diagnosis you have when you have snapping scapula syndrome. That's really pop, pop, pop. So, is it normal? Well, when you're having no pain, yes, in a way. However, here's the caution. People with no pain but they pop everything, let's not talk about the fingers just yet, but joints. No pain and popping usually means there's a problem. And that's not supposed to pop. I mean, the popping, at least as far as I'm concerned, usually means there's something going on that's indicating pathology or something's going to happen. It might take 2 decades for it to happen, but if you're hearing the check engine light or seeing the check engine light in your car and the car is riding fine, those of you who just watch that check engine light or try to erase the code, you're asking for trouble. Now, sometimes when you allude to the popping or snapping of a joint, if you're just observing it, cool. But if you're noticing any other dysfunction, or it's getting louder, or it's getting more frequent, or you're seeing more joints involved, or it's becoming painful, or hot, or red, or swollen, then that's a problem. So the check engine light is getting louder and lighter. So, lighter? Well, you know what I mean. So this is a knee. I think all of this really comes down to joints. The neck is a joint. It's several different joints. The fingers are joints. But the easiest joint that everybody knows about that sometimes usually has a snapping or popping or crunching type symptom is the knee joint. This is their knee joint. This is my right knee. So if you look at the knee from the side, here's the fibula, the tiny bone on the outside that holds muscles. Here's the tibia, the big bone, and then the femur that goes up to your hip. Now, if you look, I'm going to bend this knee up. If you look up behind, it's supposed to be the kneecap. That kneecap is technically a bone. It's also, you can consider it a sesamoid bone, but it's supposed to take this huge tendon, and the tendon connects to the 4 muscles of the thigh, the quad, takes the force of that big quad muscle, puts it over the edge of the knee into the tibia. Young people with Osgood-Schlatter have a big bony prominence here. That's not a pathology, but it happens when you're growing up with excessive pulling. With excessive pulling of this thing, with over-tight quads or over-tight hamstrings, you will lift the bone up a little bit, and that's why it usually solidifies off after you stop growing, and it just becomes a big bump. Could be a problem when you kneel, but anyway, so this is a hinge joint, and the hinge joint has a muscle that goes across it, and the muscle just happens to have this little sesamoid. The sesamoid is supposed to be there to actually decrease the friction of this muscle going over an edge. So right here, this hinge joint it's not an edge, it's a floating kneecap, but when this thing bends, it's in contact, and the muscle is getting irritated. It's getting pulled over this surface here. Now the surface, you can't see the color change, but this is bone. This smooth surface is supposed to be cartilage, articular cartilage. This smooth surface, which is usually white, like if you eat chicken and you bite the end of a chicken bone, leg especially, you'll see that white part that's chewy, soft. Well, it's meant to be soft because it's supposed to be able to take impact. It's supposed to be a little bit compressible. And it's supposed to, when you have a drop of fluid here and a drop of fluid here, you can let this thing go for 80 years without any excessive friction. Now that's if you do the normal thing and you go and walk as usual or sit as usual or kick as usual. Now if you're doing things like marathon training or you're kneeling on the ground, you're putting this joint into excessive amounts of wear and tear. And that's where the noise comes in. And that'll be one of the first reasons for snapping and popping is when you have a joint, whether it's the hinge joint of the knee or the ball and socket, this is a superficial ball and socket of the shoulder or the deep ball and socket of the hip or the multiple transverse processes of the neck or backbone, you will have a nice smooth surface if you're doing everything properly, but if you're continuing to grind down a lot, you might wear and tear one of the articular cartilages. I think this one, you can't really see it. I'll bring it up close. So this is supposed to be smooth, and you can check out, I think a chicken bone might have it, but if you check out the cartilage on a chicken bone, it's supposed to be white and smooth and slippery if it's wet. Now this is supposed to be smooth, and obviously it's a model, but this has got gouges in it. The gouges are probably just bone, but the way this articular cartilage is made is it's made of bone, but there's I think of it as an ice cream or a wax layer on top of the bone wherever it's supposed to rub. And if that wax layer or articular cartilage is intact and spongy and healthy without any inflammation, without any gout or irritation or bacteria, again, it'll rub against the other smooth surface for the life of the patient or the human. But if there's gouges in it from injury or excessive wear and tear, poor flexibility of the muscle, it will wear down and eventually get a little bit of a score in it. Those of you who are engine buffs, when you have a piston ring that gets a little bit cracked, oil leaks through, or it scratches the lining of the piston or the lining of the cylinder with the piston, and you have blue smoke in your exhaust because you have a leak or you have a tear or you have a gouge. Well, that's what happens with this, and it's painful when you have a gouge because this gouge hits this and gouges this side, and then you just have the beginnings of arthritis. So that's that's another possibility for snapping and popping is roughened surface. Now, really, the only one that has a roughened surface where it goes across and it might cause crunching is the knee. I can't think of any other areas where you might have a sesamoid bone that's bringing something over, but if you have roughened surface from trauma, then that can cause pain. But that's usually arthritic. If you are young, even if you're a marathoner or a martial artist, you shouldn't have a roughened surface. So how do you take care of a roughened surface if that's causing the pain? Well, you try to keep the muscle loose, but you try to keep the area, I guess if it's going to try to fix itself, you try to keep the area as healthy as possible. Don't smoke, eat an anti-inflammatory diet, continue to move all the time instead of stagnant positions, keep a low weight. All those things are important. Anti-inflammatory diet, we'll get to that. I might as well mention it now. If you are an arthritic patient and you're 60 or 70 or an ex-runner and now your knees are shot and noisy and painful, anti-inflammatory diet to me usually means as little animal product as possible. Definitely no dairy. I don't like dairy, even if it's organic. I just think that the body, if you have arthritis, early arthritis or advanced, the body gets more irritated when it has the introduction of a cow product. Nothing against cows or the cow industry, but I think there's uncontrolled hormones in cows, uncontrolled antibiotics in cows. And there's sometimes allergies to bovine antigen or the proteins in cows. So, anti-inflammatory diet, no dairy. Try to live as little meat as possible. Try to increase your doses of omega-3 oil. Could be from fish, could also be from flaxseed or yeast. Try to decrease your omega-6 oil. I love turmeric in the diet. If you don't have that kind of a diet, just take turmeric capsules. I'll put some links down below to other videos I've done on food and turmeric. And sometimes glucosamine sulfate, and I'll have a video on that too, these are all over the counter, but will help to make this smoother in due time. The problem with herbs is that you can't expect a 3-month turnaround time, so you have to be patient with that. So if you get it real early, like when this is starting to become painful or more noisy, you'll win in about 3 to 6 months. Glucosamine sulfate's cool. I don't know, the studies don't really show whether there's great improvement when you add chondroitin sulfate or MSM or unsanitizable products. You don't have to worry about that. It's called ASO, avocado, something. I don't remember what the other two are, but that's not a popular one, so I don't usually go to it. It's hard to find too. So I'd say that if you can, and you have a joint that's like this, a knee, try what I just suggested. But we're going to talk about now the most important thing, and one of the biggest things that will cause all joints to get tight. So I mentioned that this is a tendon that has a bone in it, and this tendon, all tendons connect to muscle. The tendon inserts in a bone, and way up here will insert into the hip bone. But this muscle, if it's excessively tight, it won't float. So the idea is it's supposed to be able to float this kneecap over the surface of this kneecap here over the surface of the femur. If it floats and your quad is loose and your hamstrings are loose, then it won't rub as much. But if you're excessively tight, you can see how it'll automatically grind. Even if you're in the most neutral position, it'll grind. Or come in contact. In fact, people who do have gouges on the back of this, they don't like to sit like this say, watching a movie theater. After about 15 minutes, you'll want to straighten a leg out because it just gets painful. Not necessarily 10 out of 10 pain, but it gets annoying. I had this once when I squatted 1,000 pounds on a sled. I thought it was great. It was adrenaline. I was working out at a Gold's Gym, I think. And there was other people watching. Saying, this is cool. I'm a sprinter, so I've got the muscle for it. But the ensuing months after that max squat, I probably had knee pain for about a year. 6 to 12 months after that, my knee pain continued and I couldn't squat anymore. That was my testosterone working. But so I worked on flexibility. Now I'm a yoga practitioner. Who would have known? So if you can work on flexibility, and how do you work on flexibility? Rolling is one form of loosening up muscle. So I don't have my rolling utensils here, but you can roll muscles with a round PVC pipe or some foam, and it's very painful because you have to get deep into the muscle belly. The muscle belly is in the middle of the muscle. You got the fat muscle, you got the insertion tendons, and the origination tendons, and that's the way it goes. But with rolling, it's kind of passive. Because you're just rolling somebody is just rolling the muscle or using your body weight to roll muscle and kind of deep knead the muscle. I think stretching in yoga poses is probably the most efficient. I'm a sprinter from high school, and I was supposed to be on track to go to Villanova, a Division I school, but I blew the scholarship, so I never went. However, I still love running, and the only way you can run and work on sprints, 100-yard dashes, 40-yard sprints without injury is really to have some good flexibility beforehand. And plus, the flexibility you do or put into the pre-run will actually decrease injury, yes, decrease muscle pulls, yes, but it also sets the muscle up for faster twitching, more calcium, faster and stronger contraction. So those of you who train without stretching, you're missing the boat. I think even if in running you can beat your opponent by 1/100th of a second, you still win. 100th of a second can be as little as a toe, the length of a toe in from somebody else. And that's where that flexibility, when you're coming and going and you're going through your gait cycle, you can win with that. But again, flexibility takes a lot of patience because it's mildly painful. I had a muscle tear from third year high school when I did a 400 medley sprint. I was on the back end, the third leg, came around the corner, I wasn't used to it, and I pulled the muscle, but I finished and handed off the baton. From that point up until about 2007, when I started to take up yoga, I had that muscle. I thought it was okay, but in yoga I could never do a certain pose. It's called pigeon pose or fire log pose until I continued to work and work and work and work because my muscles were very, very tight, even if I stretched before my powerlifting movements from before. But with yoga, you learn to relax. You learn to just hold the position instead of bounce. And every time I got to the point of trying to stretch the muscle, it would remind me, this is not a hamstring, hamstring's underneath here, but every time I tried to get that muscle stretched out, it would remind me right back into high school about what I did with pulling, and I'd think in my mind, ooh, it's going to pull again. I don't want to hear that pop because it was terribly painful. So that's why it's important to not only roll but stretch, and that's where yoga comes in handy. If you can find a yoga practitioner to teach you a specific yoga pose or several yoga poses. Now if you watch on YouTube how to do yoga, you can kind of figure it out, but you need somebody to eyeball the exacts of what you're doing, fix your mechanics. I had a 250-pound man in one of my yoga classes at Northwest Community Hospital, and his flexibility was not great, but he was trying. So I had to teach class but modify poses for him. And I tell you, that guy was on fire by the time he was done all my classes. And emotionally, there's something cool about muscle. Muscle and the way the brain interprets muscle also has an emotion. And I tell you, this guy who was very tight at first, but at the end of the quarter, able to hit triangle pose and a bunch of other poses with perfect ease. He actually started to cry. I could hear him crying in the class, or at least sniffling. I don't think it was because of allergies. I think it was because he was able to let loose maybe the trauma that he had before, which is very uplifting. So anyway, try to find yourself a yoga teacher if you can afford a good class. And I have a link on how to figure out how to get to classes, because most of the schools around you will give you your first class for free. Take advantage of it. So now we'll go. So that's the one way, is articular cartilage getting stuck or ground down or roughened. So let's take that concept of muscle. If muscle's too tight, muscle will hold a joint very stiff. So this is kind of a pretend muscle, all right? And the muscle is supposed to go across an edge. I don't have an edge. Well, it's going to be my edge. I'll say the muscle goes across my shoulders, all right? And if the muscle goes across my shoulder, if my muscle, my deltoid, is too tight, the same thing is going to happen in the knee. The deltoid will rub across. Just think of it that way. I mean, there's more to this physiology and the anatomy here, but just for making it easy, if I'm popping my shoulders and the muscles are too tight, it's going to rub on rough surfaces like that. If my muscle is loose, it'll just go across the surface without making a noise. So that's another concept. If something is going over an edge and the muscle's too tight, it's going to hit that edge tight. Iliotibial bands, hips, Achilles tendons, actually it's tendon and calf muscle or gastrocnemius muscle. Sometimes the muscles of the forearm, like with tennis elbow or golfer's elbow, they come across too tight, or you're using it too much. Muscle can be used, but after so many contractions, it wants to repair itself. If you keep on going, like a tennis backhand, if you're first getting into it and you're not warmed up, you'll overuse the muscle and the muscle will tear. When it tears partially or microscopically, it's going to want to shrink. So when something shrinks and repairs itself, it gets even tighter across the joint, and if you continue to use that joint, it'll snap across. It might not hurt that much at first, but keep on snapping any kind of soft muscle or tendon across a joint enough, it will become irritated or torn. Or the sacral fluid underneath of that muscle that's going across an edge, like a bursa, that's how it works. There's usually, if this has to go across an edge like that, then there's going to be a sacral fluid that protects it. I told you about the knee having the kneecap protect this tendon from rubbing. Well, if you don't have a kneecap around and it's just one bone on top of next to another bone and this tight muscle going across, usually I have little sacs of fluid called bursa. The bursa is supposed to be liquefied fluid, tiny sac. It's supposed to help the muscle get over a rough edge. Again, if you have a loose muscle, then you don't need the bursa. If you have a tight muscle, that bursa is doing a lot of work. You're going to have a bursitis because that bursa is going to have to fill up with fluid so that the tendon doesn't rip itself as it goes across the edge. And that is where these tiny joints become a problem, because there are muscles that attach to all these little protrusions or processes of the backbone. This is a backbone, and all of these little spinous processes, for those of you who make backbone soup or bone soup or oxtail soup, you'll see how these will look familiar to you, but each one of these has a muscle that comes off of it and a muscle and a place where it attaches. So if the muscle is really tight and it has to go across that surface, it's super tight, it's going to snap as it goes across the surface. If the muscle is loose, it'll go across the surface without any noise, which is usually what happens when you have an injury to the neck. If you're driving along and you stop suddenly, or you hit a big bump and your head goes back, that's a 10-pound bowling ball going this way at the same force as the car that was traveling before it got hit. So if you have a 40-mile-an-hour hit or a 20-mile-an-hour car and another 20-mile-an-hour car and they hit each other, that's 40 miles an hour. Head goes this way, muscles get pulled, neck goes forward, and you have a little bit of a strain. The strain causes the muscle to get fat and swollen and want to repair itself. When the muscle's fat and swollen, it shrinks. So remember, I told you before, muscle has an insertion point over here and an origination point. So when it is already tight and you injure it, I'm just going to headbutt this muscle, when you injure it, it gets even tighter. So if you're supple, you can tolerate the tight. If you're not going to run, you can tolerate that tight. Usually takes about a week to 10 days to allow muscle to rebuild itself, get the byproducts of inflammation out, and repair if you're eating properly, if you're young enough, if you're healthy enough, if you're not overweight. But if you do all those things and you smoke, it'll take you 5 times as long to repair. That's why lingering problems can be tolerated, but usually another consequence or another area will start to happen, go into dysfunction and hurt. So if you don't allow this thing to heal up on its own, or you don't allow flexibility to come, if you become very flexible while you work on the healing process and wait, then you won't have that snapping, or the snapping won't progress any further. So that's the next idea about tight muscle. If you can work on flexibility, and you would think, well, as far as a knee is concerned, you can stretch the quad and or the hamstring underneath, and maybe the calf under here. As far as a neck is concerned, you got a lot of muscles on this bear. So the problem would be, how do you stretch all these muscles? Well, again, that's where yoga comes in handy. I think with yoga is based on this axial skeleton, but it's based on every other move. But if you work on flexibility, if you have a physical therapist look at your range of motion, your dynamics of every joint around that bone, you have to look at the joint itself, or the area itself. You have to look at the area close to it, or the next joint. In other words, if you have like a knee, you have to look at the ankle, you have to look at the hip. If you have a neck, you have to look at the head and the low back, mid back, shoulders, because they're all involved. The region is all involved. You can't just work on flexibility one area at a time. The other thing is, I mentioned inflammation. If this muscle is supple, great. If the muscle is super dry, I think there's a dry spot here, then what's going to happen is going to tear. That's when inflamed muscle actually becomes torn. It'll usually not tear at the belly, it'll tear at where the muscle inserts into the tendon. That's the weakest part. You have tendon that attaches to bone, you have tendon on the other side that attaches to the muscle attaches to a tendon over here, and this tendon attaches to bone. That's the way the whole connect chain is. And the muscle usually doesn't tear in the middle, usually tears at where the tendon meets the bone. Tendon meets the muscle. So you don't want to have a tear. Sometimes worst case scenario like an Achilles, where Achilles tendon of the heel attaches to the calf muscle, they can tear, but if it tears, that muscle's so tough that you actually have to operate on that, and you have to be in a boot for about 6 to 9 months. So if it has to be, then it has to be. You can't. We sometimes use medicines to try to take away inflammation really quick while you immobilize. So how do you immobilize a neck? Wear a neck collar. How do you immobilize a shoulder? Shoulder brace. How do you immobilize an elbow? Elbow brace. Wrist, same thing, all the way down. Sometimes you can do kinesiotaping to give the body reminders. Don't go too far. And I think it does work. A lot of athletic trainers use kinesiotaping. The chiropractors I use will be really good with kinesiotaping. So that's putting you on your honor that you won't do anything bad and you won't push too hard. One of the biggest problems, one of the joys I have with working with athletes, it's not like working with, well, some people with workman's comp like to just stay in pain so they don't have to work. But athletes, you have to tell them to stop the activity. They want to go and get better. I think it's the athletic mentality. and they also have an endorphin response from exercise. And when they can't exercise, they get depressed. So you got to control. It's called relative rest. You don't necessarily be in bed all day, but you have to decrease from your previous activities prior to the injury. So that's another technique or problem. The other problem would be, like in the case of a shoulder, poor movement of the whole region. So we talked about single muscles being a problem, a hamstring, quad, or calf. We talked about articular surfaces being roughened from trauma, but I did mention briefly the other one where you have to consider the joint below and the joint above. There's something of a kinetic chain where there can be a lot of excessive work and wear and tear put on a joint if the one below or the one above it or the one to the side of it, the joint to the side of it, the next joint closest, is not working properly. So if it's not working properly, it puts excessive amounts of work on this one joint, you'll wear and tear that joint even if you have good flexibility. So that's why it's important to know the dynamics of movement, and somebody has to watch that. A professional has to watch that. That's why it's important to, when you even get fitted for shoes, to wear the right shoes, because over the course of a 5K, which is a lot of foot strikes, it's only 3 miles, but it's a lot of foot strikes, something innocent of a little tiny pop after that many strikes of the heel or foot will become not so innocent anymore, and then it's painful, and then you got a problem. So it's a tough call as far as how aggressive to get, but if there is that check engine light coming on, you should check it out. If there's snapping, popping, and it's getting louder, or if it's getting painful, no question, you got to get looked at. Whether you see a primary care doctor that's trained in sports medicine or an orthopedic surgeon, some chiropractors, a physical therapist for a free evaluation, I think it's all good. You don't necessarily have to get the best surgeon in the world because a lot of these problems aren't surgical, and that is a rescue. If you have persistent problems with that snapping joint and you've done everything, you've done relative rest, you've done rehab, you've taken your herbs like turmeric, glucosamine sulfate, magnesium, stayed away from meat products as best as you can, and dairy, eating high fiber, getting some good rest, getting away from tobacco. If you've done all that stuff, and even taken medicines like muscle relaxers and anti-inflammatories, and even narcotics, and maybe a shot of steroids into the muscle that's hurting or the joint that's hurting, it's time for surgery. And at that point in time, the surgical techniques in the United States are awesome. But even if you have a replacement of something, whether it's a joint or a bone or a repositioning of the muscle, which they can do, which is cool, you still got to work on anti-inflammatory diet, healthy sleep, flexibility. You still got to work on that anyway. So don't think you're going to get by. Even if it's that bad and you have to see a surgeon, you still got to work on that stuff. Or in the case of arthritis, I have some patients with arthritis and they get disease-modifying agents of rheumatology, the DMARDs, tough medicines, but they do turn around a lot of joints all at the same time. But they are chemotherapy medicines, and they do work by knocking out your immune system to stop attacking your joints, but you still have to work on everything else. So hopefully this gives you a little bit of an idea about what to watch out for. If you're just snapping and it's mild and it's just one area, you're not being bothered for 10 years, and no one says you walk funny, I guess it's okay. If you don't have to, if you have disability, you have to wear funny shoes or different shoes. If you find you can't participate in your sport anymore, you might want to get one of us to take a look at you and see if we can put together a program. It's always worth it, even if you have a copay. I think to get a second set of eyes to evaluate. So hopefully this gives you an idea. In Gio's case, he's got all this pain from one visit to a chiropractor. And it turned out it wasn't a chiropractor, it was a massage therapist in the chiropractor's office. But one visit put him over with pain, and since that point in time, a year or two ago, he's been in discomfort, and now it's affecting sleep, work, concentration, shooting into headaches. So I think if we work on flexibility, number one, we stop any further inflammation. Number two, we work on flexibility, at least a program. Number three, do relative rest. If we work in a construction company, or if you own a company, we still got to be careful. You can't stop working, but we have to be careful about lifting and movement and regular flexibility exercises 3 times a day sometimes. We just have to be patient. And then comes the anti-inflammatories and looking for other things that are going on. Maybe there is a rheumatoid arthritis problem. Maybe there is a magnesium deficiency. Maybe we have another problem where sleep is bad and you can't rebuild the muscle overnight. That's important too. When you do the physical therapy, you must rest because you've tested muscle, you've asked muscle to do more than usual. You're actually forcing muscle to get damaged, but controlled damage without flaring your pain up, and it's going to need some rehabilitation overnight, good sleep, non-movement, non-waking up several times a night to go pee, to rebuild that muscle so it's ready for the next time. So pushing too hard with therapy does hurt, causes more snapping, more areas, but so you can see it's a little complicated. You think this is going to be easy video, but it's a little complicated, but it does take time. I always say it's important to work on what your disabilities are. Flexibility for strength, strength for flexibility, balance and proprioception, or speed of reaction with people who don't have it. So always try to get in balance. Good question, Gio. The rest of you, don't forget to subscribe and leave your comments if you've had other successes of what you've done. Oh, one more thing. There is the popping of the fingers when you pop your... that is a theory. It's a tough theory to prove, but the theory is that when you take apart your knuckles hard enough, you can cause a vacuum within the joint, and then within the joint like here, and the vacuum is supposed to be nitrogen coming out of your bloodstream. That's a theory. I'm not sure I agree with that. I still say it's got to be tendon over muscle, maybe a little ligament here and there, but so just in case you search that and you find it, that's a low priority possibility. You can't really do anything for that. So I'm not sure I buy into that, but it still comes down to the basic facts: anti-inflammatory lifestyle, flexibility, dynamic fixing, and not causing any further harm.